Hi, I'm Jenny Grady. In this video, we will review the setup and technique for performing in-house urine cultures. This is a low-cost technique that is especially helpful for ruling out bacterial infections in pets with a low likelihood of a positive culture result. For pets with positive in-house cultures, definitive bacterial species identification and susceptibility testing through sample submission to a reference laboratory is recommended. A note before we start. It is the responsibility of the veterinarian to research their regional biosafety guidelines to ensure safe, responsible, and legal protocols are in place in their clinic before performing in-house cultures. We would like to thank the Stanton Foundation for their generous support of this project, as well as our videographer, Jeff Poole at Tufts, for his assistance in this video production. We have no conflicts of interest to disclose, and no AI-assisted technology was used in the making of this video. No animals were used in this video, so owner consent and institutional approval were not required. Before you can start, you will need a safe laboratory environment to perform in-house urine cultures. Given the potential bacterial pathogens found in animal urine, the lab space must meet the Centers for Disease Control and Prevention's Biosafety Level 2 (BSL-2) requirements. These include the use of personal protective equipment such as lab coats, gloves, and eye protection. A sink must be available for hand washing. The lab should have a self-closing door that separates the working space from the rest of the clinic, and access should be restricted when cultures are being plated. The clinic should use a biohazard waste disposal service for proper disposal of used culture plates. In some locations, disposal of positive culture plates may be governed under additional rules beyond those of other medical waste, so the veterinarian should be aware of their regional biosafety guidelines. Employees involved in plating urine cultures should be trained in safe practices. The CDC website is a helpful reference for safe laboratory practices and BSL-2 requirements. To perform in-house urine cultures, you will need a small benchtop incubator, which can be purchased relatively inexpensively. It should hold a steady temperature between 35 and 37 degrees Celsius, and the temperature should be monitored and recorded daily. You will also need disposable, sterile 1 microliter inoculating loops and culture plates. The recommended plates are tryptic soy agar with 5% sheep's blood, more commonly known as blood agar, and McConkey agar biplates, which are also inexpensive to purchase. Before plating, a urine sample is aseptically collected and put into a no-additive sample tube. A 1 microliter sterile inoculating loop is